Thank you very much, everyone. I'd like to introduce you to Dr. Bernard Kenechukwu Ezigbo. He's a medical doctor in the United States of America. We'll start by just saying hello and then getting Dr. Ezigbo to give us a bit about his background, where he was born, his primary school, his secondary school, in fact, a little bit about your upbringing. Thank you very much, Doctor.
Thank you very much, David, for having me. So, as you said, my name is Bernard Kenechukwu Ezigbo. I'm a medical doctor over here in Virginia, United States of America. So I was born in Enugu. That's the old Enugu state. It used to be Anambra State back in the days. We moved to Owerri. My parents moved to Owerri, so I went to school in an old school called Shell Camp. From the name, you can see it was built. It was a kind of old colonial school. So that was one of the good schools back in the days. Shell Camp, that was where the workers that worked for Shell in Owerri lived. So I went to primary school there. I went to the most formative school, which was Federal Government College Idoani, and I'm shouting out big time to that school. It was a wonderful, wonderful experience. I met many amazing people, including my good friend, David.
Absolutely.
Yes. And I still remember the days where we used to sing FGC Idoani. It was an amazing FGC Idoani. I will not mess up your eardrum with my singing. I'm completely tone deaf. But it was a good time. That was where we, as young kids, we learned quite a bit about, negotiating the journey of life. You learned where to have allies, where to exchange information. You learned how to put your head down, follow authority, get through the day. You learned about consequences, because I remember very well that if you did not come into dining hall on time, you go hungry. We had the guys that went to that school, remember, bless this food, O Lord, consume.
Absolutely.
So those were quite interesting times. And, as a young child, going through some of those things, you just absorb a lot of information. You absorb a lot of things that will take you through life. That was where you started learning some of your resilience, because the mornings would start very early, and, we had morning duties. Some people would, wash the disgusting toilets we had. Some people would cut grass. We had a kind of pseudo-elite group of people called the cadets. I don't know if you remember. So the cadets would be woken up very early in the morning at a very ungodly hour, where you had to go out and run for, I don't even know how long it was, maybe 30 minutes or so. But very exhausting. You come back, you find your own water, you have a bath, then you rush, you do the work of your senior, I think they call it senior, is it school fathers?
Yes, it was school fathers.
We had our school fathers and what have you. So it was just an interesting subculture of society, where you had these senior students who were authority figures, where you had the prefects above the senior students, and they were the ones that were the eyes and the authority of the teachers, who seemed almost like gods to us, So those were good times, I think. Then after secondary school, I went to University of Nigeria, where I did.
I'm going to take you back, Doctor.
Sure.
You were quite young when you got into secondary school. Now, very few people will know this. You were amongst the youngest in the set. How were you able to adapt? Because they are just knowing it now. Nobody knew it then. You were able to show a form of maturity. You know, how were you able to adapt? Can you explain or try and reflect back on that period?
Yes. So when I got into FGC when I was 9 years old, having left home for the very first time, I lived in the eastern part of Nigeria. It was about a 4-hour drive to Ondo State, the old Ondo State then. I think one of the big advantages I had, and one of the reasons I actually went to FGC Donny, was that my elder brother, who has since passed away, had gone to that school earlier. So I had two brothers. One went to FGC Okigwe, the other one went to FGC Doani. My second brother and I were quite close. So I wanted to go to the school he was going to. That was the reason I went there. And knowing that somebody had already been there and said good things about it, it gave me confidence that this was the right choice for me. So having said that, it was quite challenging. As you know, coming from middle class, upper middle class, what have you, as young kids back in the days, didn't really do much at home. You had servants and stuff like that. I would do all this stuff like washing clothes and things that you took for granted because you had the umbrella of privilege, so you just, unfortunately, you don't even notice these things. But you get to school, everybody's coming on their own. It's sink or swim. Sink or you have no choice. If you cannot make it, then you failed and you have to leave. So you quickly learn to adapt somehow. And then you're dealing with your peers, even if some of them are younger or older than you learn from them, you find out what they do, you adjust your mind. And that was key. You learn to be flexible. This is no longer home. You can't call daddy or mommy. If somebody yells at you, either you keep your head down, you yell back, they beat you up, you survive, whatever it is, you deal with it. So that's how you adapt.
Is there any incident you can reflect back on now that was exciting, that still sticks in your memory? A good incident or a bad incident? Is there anything that sort of influenced your career direction?
So the career direction, there was nothing necessarily in school, but there were a few things that stuck out when I was very young. I don't know if you remember our old classmate, Odonye. He died.
Yes.
Yeah, he died.
Ikoko. Yes.
Ikoko.
Yes.
Yeah, Odonye. And then Mr. Datsi, the Ghanaian
English teacher.
Those two people were people that I really liked, when we were young. So their dying was quite traumatic to my young brain, It's one of the things that really, really, really affected me, but not in ways that I could express as a child. Because, as a child, there's a lot going on. You're sort of going through so many things, but those were traumatic events that made me understand that somehow life is not just a joke. There are some things that will happen and it could be fair, it could be unfair, but it is what it is. The pathway for medicine for me, there was nothing in school necessary that made me want to be a doctor. From a very young age, I had this desire to help. It's how I used to think about it. When my dad would ask me, what would you want to be? As young as maybe 7 or 8, I wanted to be a priest. Initially, I wanted to be a Catholic priest. But Catholics, as you know, cannot get married. I found very young that I liked girls. I didn't think that I would be able to keep my vows. So the next thing was to be a doctor. So I said, just for that desire to help if I could, that was what set me on my path. But having said that, you asked about what was it about the school that might have influenced me in any way. good or bad. I would say for me, it was a kind of culture shock coming from, I'm an Igbo guy. Idoani was mostly Yoruba people. I had never met them until then, and we met ourselves as young people. Some of us had some, I would say, bias, which irrespective is irrelevant. We were children, and as children, based on whatever you learn from home is what you express outside. So I don't judge people based on that. However, I did make excellent friends that they were as close as brothers and sisters to me going through that school. So it was a nice experience. All in all, I enjoyed my time in FGC Doani.
Excellent. And there you were. Idoani is finished. The next stage of life is university. That was how we were brought up.
Right.
These days, some people go into apprenticeships, some stop school entirely and go into trade. In the Western world, university is not really a priority. But when we were growing up, we know that the next stage of life to be deemed successful
Right.
was to go into uni. So talk us through that period of now leaving Idoani, then getting into uni. You went to the University of Nigeria, Nsukka,
Right.
which is one of the top elite universities at that time in Nigeria. So talk us through that period and how you were able to navigate getting into that school.
So it was similar to going to secondary school because I had elder brothers that had already been in university. They were able to give me advice and sort of guide me. So that helped me quite a bit to avoid some of the things that some of my colleagues, some of my peers, unfortunately, did not learn, and some of them did not make it through school. So it was an amazing experience. You're here, your hormones are raging, you don't really know how to interact, but you think you're a man, but you're a child, or you think you're a woman, but you're a child. And almost same thing like secondary school. The senior people, the older people were looked up to with so much respect. They were the ones that were in charge of the school. What they said went. Some people joined some clubs and what have you. Some people did not. There was just this social strata. It was quite interesting. In university in Nsukka, there was this elitist. You had some people that you could say, somebody you might have grown up with. Once they get to school, depends on the crowds they move with, they will not talk to you because you don't belong.
Absolutely, that's
true. So once you get through that and you start understanding that this is how life really is, sometimes, same thing, you have to adapt. People yeah, go ahead.
Did you get into read medicine directly, or did you have to switch courses, or how did that play out?
So when I got in, I actually got into dentistry.
Okay.
Right. Then during the course, I changed to medicine.
Okay, but was there a reason why okay, obviously you've told us that you always wanted to either be a priest or the next best option was to become a medical doctor. Is that one of the reasons why you switched from dentistry to become to read medicine then?
No, well, the dentistry aspect was that I did not. I don't know whether if you are, I'm sure you are aware, the cutoff for people from my state was quite high to get into medicine. So it was a big disadvantage. My JAM score was high enough to get into many other schools, but not to get into UNN, which is where I wanted to go to. So I had to start with dentistry. Then along the way, I switched over to medicine.
Now, studying medicine in Nigeria, if I remember quite well, was 6 years. Does
Yes.
that mean you had to do an extra year to make it 7 years in Nsukka?
No, it was more like what kept us back was the strikes.
Okay.
All these
The SAP riots.
all this stuff that kept going on. It kept on going on. There'll be times 6 months will pass, we haven't gone back to school. 1 year
Yes.
will pass, we haven't gone back to school. So it just kept on moving on like that and kept delaying things. So that's what kept us back.
And you finally graduated in what year?
I left school in 95.
95. And as soon as you left school, please talk us through that period before your emigration out of Nigeria.
So it was by then things were getting a little bit more difficult in Nigeria, as you would know. Even in medicine, you couldn't get into to do housemanship easily unless you're willing to go anywhere in the country. At that point, I wanted to remain within the East. This was what I was now used to. I wasn't quite prepared to go towards the West or the North to do internship. There were limited spots. So I started at Aba for a few months, waiting for my alma mater to create an opportunity for me to get back there. So I did 6 months in Aba, then I went back to Enugu campus and did my 1 year. After finishing internship, which is you go through medicine, surgery, OBGYN, obstetric and gynecology, that is, and pediatrics. Then I had to do youth service. So youth service was like a kitty. So I went back to
that axis.
Yes. The youth service was quite interesting. Stayed a few months, and then I went and worked in Port Harcourt before leaving the country in '98.
And what was the desire and the reason to want to leave Nigeria? Here you are, a young doctor, one of the best being produced at that time. The country would have needed your expertise. What was the influences to deciding that you had to leave Nigeria? Was it to further your education, or was it the system starting to get bad? Can you please just explain a bit about that?
Yeah, I think both of them were part of the problem. The big thing was in Nigeria those days, right? When I graduated from medical school, I became a doctor. I was still getting money from my father, which was a big shame. They would not pay us salary for 6 months. So here you have a young doctor who is working, and he's still going home to get money every month to survive. This is untenable. There's no way that somebody should live like that. So that was part of the understanding that, look, the things are trending in the wrong direction. And when you listen to the news, you listen to the media, you listen to the government officials, you could see that there was no plan in place to improve things. It was more like, well, this is how we do it, take it or leave it. They will say, oh, they paid salary. The boss or the CMD or CMO, what have you, will keep the money in their account, is what we were told, for 6 months to get the interest before you pay. And nobody was held accountable for that. And the way it was in those days, if you complain too much, they get rid of you. So it was one of the things that I understood. This is not what I want for my life. And then I had colleagues, friends who had left, and they had, they called back and say, hey, this place is good. I've been here for months. They pay me salary every single month. Of course, as a young man who wants to get ahead with my life, I had to leave. And obviously, at least then, even now, we believe that going to United States was a country that had so much opportunity for people who are willing to work hard.
But you didn't go straight to the US.
Of course.
You stopped in Trinidad and Tobago. Now, let's go back. Were you already traveling abroad, in those good old days during the summer holidays? Some of us privileged ones would be sent to London on summer holidays or would be sent to the US. So, if you were, so you would have been used to a different culture.
Right.
When you got to Trinidad and Tobago, which is also a black community, a black country, what were the contrasts? What was it like? What kind of how will I explain it now? What was the differences between Trinidad and Tobago and your home country, Nigeria?
That's an excellent question. And that leads to how things have progressed in my life. Yes, I had gone abroad before getting to Trinidad. So I'd already seen how other people lived. I mean, London, as went there, it was an amazing, it's an amazing place when we were younger. Of course, you catch all the old usual racism stuff, but it's sort of what you get used to. It's not a big deal. At that time, you didn't even realize it. But, people, I'll be walking along the street in London as a young guy, and somebody could cross the road. At that time, I didn't think much of it. It was just talking with people. I started understanding what this is. Because, as Nigerians, because of the way we lived amongst ourselves, we're all very tightly knit. Everybody's on top of everybody. If you're in line, somebody's right behind you. We don't have things like social distancing and things like that. This was our culture. This is what we thought it was like everywhere. But you come outside and you have that cultural shift in perspective, and then you learn. But now going to Trinidad is the way Nigeria was in the 70s. It's a very beautiful, nice island. People there are relaxed. They were welcoming to Nigerians earlier on. Unfortunately, some people came and, at that time, Nigeria was going through a lot of psychological upheaval. People were losing their moral compass, and whatever bad behaviors they learned in Nigeria, they brought to other countries. So Trinidad was like getting a little bit hostile towards Nigerians, appropriately, I would say, not because they are bad people. Now, Trinidad is a population that is almost split in half between people of African origin, the Afro-Caribbeans, and people of East Indian origin. So it's not necessarily a completely black country. It's like half and half. One of the cultural shock of it wasn't so different because we've gone through so many things, but they have a different outlook on life. That was the first time and first place I'd seen where people did not treat you differently based on your social status. So if you're a rich person or a poor person, nobody cared. That was really, really good to see. If a multimillionaire comes into the hospital, for example, nobody's going to run around. He will bring his own stuff in. He'll wait in line like everybody else. He'll be treated like everybody else. If he dares to say, "Do you know who I am?" the person next to him will show him that he is nobody. So their culture, maybe because of their history, they really, really did not like to be told, "Stay in your place." So that was quite refreshing. And the other positive thing I saw in Trinidad was that every single month, when it's time for you to get your salary, you are paid. Every month. That was the first time in my life I'd seen that. And the people were allowed to speak their voice. Everything they wanted to say, they would say. And they also had oil. They had oil. But the difference between how they were treated in their country was that they held the oil companies accountable. If there's an oil spill, on the beach or wherever near the beach, the oil companies will fix it. They will fix it before they're allowed to continue. Does that mean there's no corruption? There's nowhere in the world there is no corruption. There's corruption everywhere. But the government held their stakeholders accountable. And because they showed that they respected their people, all these other companies, the same companies that are in Nigeria and just devastated the Delta, they were responsible in Trinidad. While I was there were a couple of times they had some small accidents. They fixed it. So it was all in all a positive experience. And just to finish up with Trinidad,
go on.
If you go to the embassy to get visa in Nigeria, just to give you a difference in the way it was, a Trinidadian will go into the embassy wearing shorts and jeans, and he'll get 10 years. The only people you see there who are looking so formal with their suits and everything are Nigerians. They're Nigerians. They understood that their country is solid. They were not desperate to leave. And because they were doing things the right way, embassies will respect them and take care of them. I remember going for a visa while I was in Nigeria. Early in the morning, some people will stay in line, and it's not a question of saying it's the population because there are so many of them. No, it's because the country was doing things the right way. After all, when we were growing up, you didn't need a visa to go to England. What suddenly changed? That time, you just buy your ticket and fly over to England. But, consistently, we just kept on going towards the wrong direction until the bad became almost cultural. And everybody is just messing around. But
absolutely, you're absolutely right there. You could see the degeneration, the degrading of society happening in Nigeria at that point in time. Right. I'm sure there are historians who, in time, give a proper account of what the situations were in that era. But let's go back to Dr. Bernard Ezigbo. You're in the Caribbean, Trinidad and Tobago. What gave you the motivation to decide to go to the US? At this time, you are now independent. You are now making your choices yourself. What was it that made you tired, not necessarily tired, but decide that there was a next step, which was going to the United States of America?
Well, the first thing is I always wanted to, specialize in something because in medicine, you're a doctor. As in Nigeria, for example, you're a doctor. But if you're a specialist, if you want to be a specialist, in my opinion, the place to be a specialist, the fastest place, the place that will give you most opportunity, the highest chance of actually doing what you want is the United States of America. I'll give you an example. In England, I don't know, this is based on just what people say. I never worked there. I did do a couple of rotations in St. George's Hospital when I was very, very young. But the system is different. You can graduate and pass all the exams, but you'll not be a consultant until there may be an opportunity, somebody maybe retires or resigns. There's a limited spot is what I'm trying to get at.
A limited opportunity
to move on. But in the United States of America, if you get through the training program, which is pretty straightforward, you can do a fellowship, become what is called an attendant, which is a consultant in Nigeria, equivalent consultant in Nigeria or England. So you get through the States, do your 3 years program and do your fellowship and you become a consultant. So I wanted to specialize in something. I actually wanted to work in the States. Coming to Trinidad was never like a place where I planned to come and settle. I needed a kind of base outside of Nigeria to make my plans because it wasn't just like going to United States. No, you go to United States, if you're not an American citizen, for example, you have to leave after a few months. You have to plan that if you wanted to go to the States, you want to go in there and become legal citizen. So you always wanted to be able to do that. So it wasn't like just going to the States and just staying and waiting to take your exams. And you have to take exams to practice in the United States. If you don't pass your USMLE exam, you can't practice in the States. So it made no sense for me to just go to America and just start staying there. Trinidad was an opportunity where you have dignity in your job, they pay you salary, you can study, take your exams, pass your exams, and move on. So my plan in Trinidad was always to go there and take my exams and then go to United States.
You got into the US, you immediately started working in Brooklyn. I believe Brooklyn is in the state of New York. New York is a state, isn't it? You apparently started working in internal medicine. Please tell us a bit about internal medicine to a layman. I wouldn't know what internal medicine is. Can you just give us a brief description of what internal medicine is?
So the way medicine is separated in the United States of America is that you have pediatrics, which deals only with children. You have internal medicine that deals only with adults. Now, internal medicine, and then of course surgery that deals with surgery. Then each of these broader categories have subcategories. Internal medicine, you can be a cardiologist, you can be a pulmonary critical care doctor, you can be a nephrologist, you can be an endocrinologist, rheumatologist, and so on. Or you can also just be internal internist, which is like a family practice doctor. But unlike the GP in England, we do have family practice doctors, which is another subtract of medicine separate from internal medicine. So basically, internal medicine deals with adults. Okay, emergency room medicine deals with emergency rooms. Completely different from internal medicine. So you have doctors, and each person has their lane they stay in. You cannot deviate from that lane. For example, in America, if somebody comes with a suit, with like a cut, even if in England or in Nigeria or Trinidad, I can suture it. In America, I'm not allowed to suture it. You call the surgeons to do the suturing.
Okay.
So you stay in your lane. You're dealing with adult diseases, period.
Okay.
Yeah. So that's what you do. So it's so you go through the training, which is 3 years. Yeah, 3 years for internal medicine, 3 years for pediatrics, 3 years or 4 years for emergency room. Then after doing that, you now do, if you want to, you can start working or you do more studying to be a subspecialist within those subgroups I was telling you about.
So I've always heard about the Mayo Clinic. You have a fellowship of the Mayo or in the Mayo Clinic. I've always heard Mayo Clinic, Mayo Clinic. Can you tell me a bit about the Mayo Clinic? Is it like a big organization or is it just a hospital? Please.
So Mayo Clinic, which is, it's like one of the premier institutions in the country, and I would say the world. It was a kind of system that was built by two brothers, the Mayo brothers and their father, who emigrated from England actually last century. So one of the brothers had a bad experience during his training abroad, and he had a philosophy that what he went through, nobody should go through that. So that's the overarching mindset in Mayo Clinic. Over there, everybody's treated fairly equally. There's a push for diversity. You're encouraged to speak your mind. So that mindset where we're all working together towards a common goal, somehow that philosophy has persisted from almost the founding of the institution to where it finds itself today. It's a huge institution. The average budget, I don't have the number offhand, but it's probably like $2 or $3 or $4 billion a year.
Wow. Okay.
Yeah, so it's a huge institution. For me, it was the biggest privilege of my life to be accepted to do critical care fellowship in Mayo Clinic. And it's something I couldn't believe happened to me. It was an amazing experience.
Fantastic. So you specialize in critical care.
Yes.
You are amongst the critical care doctors when things get out of hand. That's when you actually see patients.
Right.
Tell us a bit about your job, especially related to the COVID period. A couple of years ago, the whole world got infected by
Right.
COVID. How has that affected your critical care job? What contrasted to before COVID? Tell us about pre-COVID, COVID, and now that COVID is easing.
Right.
Can you just talk us through that, please?
Sure. So, critical care, just to start with, basically, how I would describe an intensivist, which is what we call a critical care doctor, is the doctor, just like the emergency room physician. They're the doctors who are running towards a burning building when others are running away from it.
Okay.
So when somebody is dying, for example, they come in, blood pressure is very low, the heart has stopped beating, or they're having a stroke or an emergency, we are the people that handle it. It starts with the emergency room physician. They try to stabilize the patient. They usually call us for advice. Sometimes we come down to the emergency room and work with them to stabilize the patients. So basically, we use our skills and knowledge to do the work of the body when the organ systems have failed. So we find a way to support each part of the body, So that's part of it. Now, pre-COVID, we've had SARS and MERS. So we've had these coronavirus infections over the past few years. We had the experience of this kind of weird respiratory pathogen that kills people. Then we had the Ebola and all those other things that happened. Having said that, when COVID affected the United States of America, in my institution, for example, everybody knew at that point that it was a respiratory pathogen that affected people in a very, very difficult way. We had lots of people dying every single day. Now, going into the period of time, there was a very dark period in all our lives. We didn't know then what worked and what didn't work. Some of the things that we took for granted in our philosophy practice of medicine was not working. For example, when we put people on the ventilator, for example, you expect improvement within 3, 4, 5 days, depending on the reason for them to get so sick. COVID, they were not getting better. And at that point, some of the things that we didn't know whether what we were doing was working or not working. Everything was just going on and we were learning with the job. There are all kinds of theories going on. So we were trying our best. And the other part of it was when you are trying to take care of the patient, you're hampered by your protective equipment that you have to wear. You have to wear respirators, you have to wear, goggles, your gloves, your mask, you're doing all these things. It was a very difficult time because you saw people and you read on the news and you heard how people were dying every time, and also that it affected minorities, especially African Americans, disproportionately than other races. And then you also had the media telling lies, I would say it straight up, telling lies about whether this was a serious infection, whether it wasn't a serious infection. We had patients who, whether breathing and dying, are still denying that this is real. At the point of death, they're telling you that I'm not dying of COVID. So these were all things that used to compound the difficulty in our practice. And then you're worried about bringing the virus home to your family. Most of us, you come home, you actually take off all your clothes in the garage, leave everything, leave your shoes outside of the house, rush in, nobody should touch you, or you stay away, you wash everything, shower, and then you stay away from people for a while. So all of that was a very difficult time. It led to a lot of mental stress.
Yes.
And I think many people are still going through the post-traumatic stress.
Ted, you were going to talk about mental stress. Can you, based on the COVID experience, just use that as a base to tell people about mental stress, especially our people in Nigeria who go through a lot of mental stress with the systems not working the right way? Please emphasize on it, educate our audience, and let's see if we can seek solutions.
So I think the first thing I'll start with is to tell people, that having a mental problem does not mean you're weak. That's key. If you have a mental challenge, reach out for help, whether it's whoever you trust, whoever is responsible, whether it's your doctor, your loved one, your pastor. I'm having a mental challenge. Start with that. Saying that you are mentally compromised, right? Confess it is real, and then take steps to help yourself. Some of it is not beyond helping yourself. Some of it requires actually medication. You have things like bipolar disorder, schizophrenia, schizoaffective, so many different mental things. I'm not a neurologist a psychiatrist. So I will not want to be in a place where I'm telling people their diagnosis. What I will say from the critical care standpoint is this. For us, we found that physical activity helps us cope. So you find that a huge proportion of people in critical care and emergency room, and even surgeons and anesthesiologists, they tend to exercise every day or as many days as they can in a week, because exercise helps you. It releases endorphins, which is the kind of feel-good hormone that helps to keep the brain calm. We believe that a healthy brain goes hand in hand with a healthy body, and these are ways you can cope with some of the challenges that you're going through. I'll tell you one thing. During the COVID era, right, this was the time I found the bravest people I've ever seen, David. You have nurses and doctors who walk into a room with somebody who has COVID, knowing that they're walking into a situation that could kill them. I wrote my will. I did. I wrote my will and sent it to my family that in the event I die, this is what I want for my family. These are my wishes. Just imagine that. You deal with that, but you still have to go to work every day. You still have to stay calm. You still have to support the dying patient and support the staff, as well as support the family members who are not able to visit their loved ones.
There was a period in the UK where every Thursday 8 p.m., we'd all come out and clap for the healthcare workers because it was a war, actually. It, um, COVID was considered a major enemy, and it was a major triumph by you doctors, the nurses, the health practitioners, barring all conspiracy theories that were flying, that still fly about,
Right.
you know. And we had to clap for the health experts because if it wasn't for them, the world would be a completely different place. We're so lucky that the vaccine
Right.
were developed and were effective. You're right about mental health issues. The children had to stay at home during lockdown. I have a 12-year-old. I could see his frustrations and I didn't know how to deal with it. But learning from what you're saying now, gives me an idea. Exercise helps.
Yes.
Uh, Admitting that you have mental health issues, it is not a stigma. Everybody at some point has mental health issues. It is just how we handle and deal with it that
Right.
that helps alleviate the problem.
Right.
Please carry on. I just wanted to emphasize that a bit.
Yes. So I think whatever coping mechanisms that somebody can develop, exercise, reading, relaxing, gaming, some of the not drinking or eating too much, some
Yeah,
of those, yeah.
but drinking is part of the coping mechanism where we come from.
Well, that's the problem. That yes, I agree with you. We do that back home in Nigeria. You can have a liquid breakfast with your food, and you can have you have business meetings. You drink alcohol. You drink alcohol in the morning, afternoon, night. So our coping mechanisms in Nigeria, our coping methods are actually contributing to our morbidity and mortality, to our sickness in
Yes.
Nigeria. And yeah, before I forget, because it's very important to try to help our people. So mental health is one thing, but however, I think some of the strategies to help the most people. Let's look at some of the things we need to talk about, David. I know we're running out of time. One of it is if we can encourage our people to check their blood pressure at least once a day, if possible. The number you're trying to get is below 140 over 80. Okay? 140
Yes.
over 80, you're trying to go below 140 over 80. That's just a basic number. The lower the higher number the systolic blood pressure is, the better. If it gets below 100, there's a problem. Just let people keep that in mind. Now, when you get towards 45 years old, it's encouraged that a black man now, or even black women, do a colonoscopy. Okay? It's something that people need to overcome because there's this almost like cultural barrier. The idea of somebody putting a tube through somebody's backside to look for the colon and to look through the colon and look for that. We need to get beyond that. Okay? Colon cancer is one of the commonest cancers that kills black people. You know about Chadwick Boseman, the Black
Yes.
Panther actor. That's what killed him. It was an unnecessary death. If, for example, somebody has a family history of somebody that had died of colon cancer, then they need to look at the age at which they had colon cancer and 10 years earlier than that, start doing colonoscopy. It's very, very important for somebody. We at our age, in our classmates, you know, we need to encourage them to get a colonoscopy to check their prostate. We do have young black men having prostate cancer early. So I think blood pressure is key. Reducing our salt intake. Black people are very salt sensitive. And unfortunately, our diet in Nigeria is very salt heavy. So encourage people to try and eat healthy, cut down a little bit on meat. Nothing wrong with a little bit of meat, but not too much every single day. Exercise. If you can't go to the gym, take a walk. Don't take the elevator, walk up the stairs and downstairs as much as you can. So I think if you can control blood pressure, reduce cancer, check your heart, check your cholesterol, check your mental health. Just those few small things before we start getting into the technology, the part of the things that we do here in critical care, which it's going to be very, very difficult to implement back home because of resources and things like that.
Absolutely. Now, you have a passion for wanting to educate our people and trying to elevate the quality of healthcare in Nigeria. Now, in the recent past, the New Nigerian, which is the platform you are on now, has equally spoken with other doctors just as passionate as yourself. And we've been able to convince some of them to start the reverse brain drain, like I said, by joining or organizing projects that are being developed as not-for-profit projects in Nigeria. As you are aware, the New Nigerian has a few projects which you have contributed immensely to, of which we are very grateful. In parts of our private conversations, you've equally talked about projects that you've tried to enhance, that you've participated in Nigeria, that are either successful or unsuccessful. Can you tell us a bit about what you would want to implement, how we could collaborate with other doctors or other facilitators to make these things possible? Part of our problems, like you were just trying to allude to, is equipment. Our officials, top government officials, leave Nigeria, go to the UK or America or India for health care. I don't know what hospital we have on ground that would be able to facilitate or take care of those kind of ailments that they have to leave for. But the country has the money. So what would your suggestions be around that? And how do you think we could collaborate as a unit? We already have some collaborations going on, which I will share with you eventually in private discussion. But please talk through that a bit.
Well, I think because of our population density, what the way I look at it is the strategy has to be, how do you maximize the good with limited resources to the highest number of people? So I would say, if instead of doing like big things like opening a cath lab where you do cardiac catheterizations for people with heart attack and things like that, which has its place, but it's still the same thing. It's going to provide service to only people who are well off or those who have the resources, as the case may be. I'm not sure it's going to be a cost-effective strategy for Nigeria the way things are. So I'll say one of the things that will need to be done will have to be obviously education. And if we take one subsection of what we think is killing people the most in Nigeria, for example, malaria. Malaria is something that everybody understands, right? So what is the strategy that we can do to help reduce malaria infestation in Nigeria? Mosquitoes, right? How do you deal with that? If your viewers can just take a chance or take the time and just find out how is it that Walt Disney World in Florida, right? They came up with a strategy whereby they built it on a swamp with mosquitoes in those days. There are no mosquitoes whatsoever in Disney. This is in Florida that is hot and humid like Nigeria. Just simple strategy. Get rid of standing water. We know that mosquitoes cannot breed in running water. If there is no standing water, you reduce mosquito infestation. Just that simple thing. If we can reduce mosquito infestation, we reduce people dying of malaria or getting sick from malaria. That's one. And that's public health, which I'm not a public health specialist. There are people who are better equipped to be able to give the information on how to do that. But that's just one thing I'm thinking about. But from my perspective in medicine, I'll say one of the biggest things that we can do to help people is reduce high blood pressure. So that's one thing, just a simple thing. If, for example, we can get like sphygmomanometers, which is the device to check your blood pressure, get a lot of it. If we can get like people to contribute or donate and send it home, or have a local resource, source it in bulk to be able to send to as many people as possible, a family, one or two families in a community, educate them of the numbers they need to see and things that they can use to keep it under control. Just from public health point of view, you can just reduce people's blood pressure. That would be something that will help. If, for example, you now get to the bigger hospitals and where you're not talking about trying to improve the quality of people who are more comfortable, who shouldn't be going abroad for healthcare since the equipment that they need is in Nigeria, then I'll say the biggest thing we have to talk about is reducing, basically sanitation. So I'm not sure how, I've not been to Nigerian hospitals in a long time, so I don't really know how things are now. But learning to wash your hands between procedures, disposing infected material, just that circle of sanitation, disinfection is very, very key for our practice here. I think those are just three things that come to mind very quickly before you start talking of exotic things.
Fantastic. You see, the Federal Government College Idoani hopefully still produces dynamic, intelligent, and fantastic people. Now, one of the things we do, like I said from the beginning, is to get the best in diaspora and see how best they can export their knowledge or experiences to Nigeria. There's a scheme called Health for Nigeria.
Okay.
It was developed by an Idoani alumni living in North America, in Canada. It's called A Nurse, a School. If you remember when we were in secondary school, we used to have a health center.
Right.
All those things no longer exist. But he is developing it and is now making it practical. In Ekiti State, he's already established 5 schools where they have nurses. There's a health center being developed in Edo State now, which is also going to be modeled with the Health for Nigeria scheme. Now, we have charities also who try to help the sick, the less privileged in society. In fact, last week we spoke with a gentleman called Nuhu Kwajafa, who has a charity organization who helps sick people with deformities, gets people to donate, even if it's just food. He started by people donating food. Now, what they do is they find the sick, get people to donate, and see if they can find a solution to that medical problem.
Right.
In fact, he told us about the first child ever born without a skull. It was a unique situation, and we only found out that Dr. Ben Carson, who was part of the Trump administration, actually did the operation, a successful operation on this child born without a skull. The child is in the US right now. Obviously, we will do a follow-up with Mr. Kwajafa. Would like to see that child and interview the child, So going on that basis, What we would really tentatively like is to seek your expertise at any certain point uh, to further these already ongoing projects. So, what we are planning in essence is to get all the doctors who we've spoken to, all these people, the NGOs we've spoken to, into one joint session and see if we can find a solution, because talking brings about solutions.
Right.
Um, so I hope you'll be interested in partaking. Like I've told the audience already, you've contributed immensely in no small measure to the schemes going on already in Nigeria. Uh, Nothing is too much, nothing is too small. I hope this will help people understand that all this is needed to turn our country around. Because if you look at it, Dr. Ezigbo, our generation benefited immensely from Nigeria. So there's no reason why we cannot start to give back. Um, People always say the country is finished, the country has problems, but people fail to realize as well that the country is blessed. It's not just blessed by natural resources, it's blessed by the best brains.
Yeah.
It's blessed by people in diaspora who have emigrated based on the situations and are being utilized by other countries to better their lot. So why can't we all come together and reverse this and start to rebuild our country? It might not happen in our time, but if we start it, there's no reason why at some point in our children's time, things can't get better. This is what we hope for, you know. And I'd like to thank you again for your immense contribution. I'd like to thank you for your time. I would just ask that you use the next 2 minutes to address the audience, um, let them know what you think, um, how you can help, how they can reach you if they do decide to. Just let our audience know about you a bit more before we end our conversation. Thank you.
Thank you, David. I really enjoyed, chatting with you. Well, I mean, for the audience, my belief has never been that Nigerians lack information. We do have a lot of information. We do understand what's going on. I think the biggest challenge that we have as a country has always been this continued degradation of trust. Okay, so I think if we start by just doing a little bit at a time, it will make a difference. I think we start by understanding that there's nobody going to fix Nigeria but Nigerians. Okay, the countries that we've all gone to have had their stumbles, but they themselves fixed their country. Nigerians have to start by understanding that we have to be the change we want, and it takes us being honest and open with one another as much as we can to rebuild that trust. We used to trust back in the days. Obviously, the trust has been broken because of the experiences that people have gone through. However, as a society, if we start changing our behavior, we'll start changing the country slowly. I am not somebody who does social media, David, as I've told you before. So I'm not going to be somebody that will say, reach me here or there. My thing is, I will communicate with you. Through you, I'll talk to people if they want to talk with me. What I'll do from my perspective will always be private, because I'm not somebody that's going to get involved with, government interactions. I will not do it. I would like, yes, I would like to do things privately, have a conversation. If anybody needs for me to give them information based on what I know, I will. If they reach out to me through you,
yes,
I'll talk to them. But I'm not going to say, hey, reach me here or there.
Excellent. Thank you so much, Dr. Ezigbo.
That's just what
The TNN crowd, the TNN audience you've heard from the doctor is a doctor of critical care, doing his own tiny bit in his own tiny section. Tiny bits turn into large bits. So let's take a leaf out of Dr. Ezigbo's page. Let's start trusting each other again. Let's start rebuilding our country. Just like the doctor said, we are the only ones who can do it. Other countries have gone through their own problems. America is over 300 years old. They still have issues, but they work on it. And the aim at the end of the day is to get a better nation out of who they are. Right. So let's adapt this. Let's keep talking. Let's keep coming together. Gradually, we are quite sure that the reverse brain drain will take hold, will take effect, and we'll start developing our country, which we have started, by the way. Although they are in silos, eventually everybody will start to get together. The sooner we realize, according to Mr. Nuhu Kwajafa, that the greatest thing we can give is love to one another, the sooner we start to move forward. It's been an interesting 1 hour. It's such a shame it's come to an end. We hope that there will be a follow-up. We will keep updating you on TNN projects. At some point, there will be a page on the website where you can be updated yourself. All you have to do is click on the link and you will see the projects that are taking hold and the projects that are moving on. We didn't get to talk about the misses or the children. We hope we can do that in a follow-up. We are most grateful for your time, and we hope that you give them our love as well. Thank you, Dr. Ezigbo, for your time, and we look forward to you joining in some more projects or some more podcasts where we're finding solutions. We are most grateful for your time. Thank you so much.
Thank you for having me, David. Have a good day.
Excellent. You too.
Okay.
Bye
Bye-bye.
for now.
Bye-bye.